Thank you. There is a new study now from the Journal of the American Association that it suggests that 1/3 of people with asthma may not actually have the condition. Dr. Chaffoo is here to explain all this. Doctor, good morning.
Good morning, Raoul.
Okay, first things first, what is asthma?
So, Raoul, asthma is a chronic lung condition that's associated with swelling of the smaller airways, and patients with asthma have these recurring bouts of wheezing, breathlessness, tightness, cough, difficulty breathing.
And they're scary to experience and
Very
to
frightening.
witness as well.
Exactly.
So what is this study all about, saying 1/3 of the people actually may not have it?
Well, it's a fascinating study, Raoul. It was a study that came out of Canada, and that researchers actually found randomly 700 people that had been diagnosed with asthma in adults in the past 5 years, and they looked at those people and they reevaluated them. They found that about 1/3 of the people that initially had been diagnosed with asthma actually didn't even have asthma, and actually most of those people were actually taken off their medications.
That's incredible. I mean, how many people are we talking about here in this study?
So we were talking about 700. So roughly, if you look at the numbers, it's a significant percentage. It's hundreds of people.
Wow.
And Raoul, the interesting thing about this study is it does actually stimulate a debate among healthcare providers and researchers on how do we diagnose asthma accurately. You know, if we're talking about diabetes or heart disease, there are very specific tests to evaluate someone and to rule in or rule out those diagnoses. You know, unfortunately with asthma, by the time a patient presents to an emergency room or to a physician's office, their acute asthmatic attack, their wheezing, their coughing may have gone away, and their physical findings may be completely normal. And so it can be difficult to diagnose that. We know that these are their symptoms: coughing, shortness of breath, wheezing, tightness or pain in the chest that will stimulate the patient to go to the emergency room or their primary care doctor. Now, when they get to the physician's office, there is a test that can be done called spirometry, and that's a test where you actually breathe into a device that measures your lung volume. If you're having symptoms at that time, Raoul, your spirometry test will be abnormal. The problem is it's a very non-specific test, and if you get to your physician's office and you don't have any symptoms, the spirometry test may be entirely normal.
Can you ask for that test? Because quite frankly, when you look at that list of the symptoms, coughing, shortness of breath, tightness, and pain in the chest, it could be a laundry list of other things. So when you show up, can you say, well, it could be this, it could be that, it could be that?
It's very true. So the spirometry test is, and it's important for the public to understand, it's a non-specific test. It may be helpful. There are some physicians that will use methacholine or MCT test, which is actually inhaling an agent that irritates the bronchial airways, and then repeating that spirometry test to show a reduction in lung volume. That seems to be a little bit more specific for helping to diagnose asthma, but the problem with that test is if you have asthma, you know, stimulating an asthmatic attack can be a serious problem. You know, we know about 9 people a day in the United States die from asthma. It's a disease that affects anywhere from 8 to 9% of the U.S. population.
So as always, if you think you got something, you just got to go to the doctor and ask questions. Questions. That's what you guys are there for, to be honest with you. Thank you so much, Dr. Chaffoo. Enlightening stuff this morning. Thank you.